The second phase, I guess you could call it, of our Center for Autism and Developmental Disabilities is to move beyond our feedback session. So after this beautiful evaluation, we bring the parents back, we sit them down, and while we definitely need to connect them to the community, we very much would like to keep these patients in our system as well. And at this point, we're directing them out for other therapies or resources that at some point we would like to keep inside the system as a means for continuity of care, communication, in the same way we communicate as a multidisciplinary diagnostic team. We want to have better communication with therapists who have ongoing contact with patients. So our plans for the next 1 to 2 years are to introduce a menu of intervention options that are geared towards the individual needs of the child. So we believe that every child, autistic or non-autistic, has a unique profile. And so, for example, your 3-year-old autistic child may be appropriate for an ABA program, which is a behavioral therapy program. Another 3-year-old may not be ready for an ABA program. Maybe they need more of a social communication program, which could be offered through our speech and language department. You know, because we're finding many of these children are not autistic, but may have behaviors that are appropriate for certain kinds of therapies geared for children with autism. We would like to be able to help parents whose children have social, communication, behavioral, emotional issues. So we are planning for behavioral therapies, for even nutrition consultations, and Dr. Johnson can talk a little bit about some of the ideas in the way of the immunization concerns right now and what we're looking at as far as consulting parents and helping them make informed decisions about vaccinations. We are looking to add a sensory integration program at some point. The parent-child interaction therapy, and Dr. Reed can speak to that a little bit more so than I can, but would certainly benefit a wide range of children we see here.
Mm-hmm. Along with some of the applied behavioral analysis, which is one of the evidence-based approaches for treating children with autism spectrum disorders. Another therapy that seems to be quite promising for young children with and without autism spectrum disorders is parent-child interaction therapy, and we're in the process of looking at how we can implement that here for our patients. We've had a number of patients for whom we feel this is very helpful, but they've had difficulty identifying the services, so we feel like this is something that we can pursue and help out our patients with obtaining. Another approach that we're doing is also making linkages with some of the therapy programs in existence in the Department of Behavioral Health Services, primarily some social skills interventions and groups that might be helpful for high functioning or higher functioning individuals with social competence and social skill deficits, as well as older children.
Okay. One of the things that we want to do in our center is we want to be sensitive to the needs of our parents. And so many of our parents are parents of children with autism are left to discover things on their own without guidance or direction. And we want to be a place, a resource for our families to come when they have specific questions. And right now, many children with autism parents are searching for dietary interventions to affect specific behaviors. And we want to establish a place where they can come work with the nutritionist alongside a pediatrician to develop to address the parent's specific dietary concerns. If parents choose to select a restrictive diet, they can have guidance with a nutritional services and a pediatrician to find what's appropriate and safe for their child. We want to be a place to educate parents and support them in their treatment options. Through this process, hopefully we can establish particular behaviors, come up with a plan, and then see that plan through and determine whether it's effective for the child and for the family. To that end, parents of children with autism have a lot of questions and concerns about immunizations. And we hope that we can, for parents that are opting out of immunizations, we can be the place for information about the diseases, the vaccines, and why we immunize children. For parents who choose to come up with an alternative schedule, we'd hope to come up with an alternative schedule that is a consensus, so that parents can follow a schedule that has been developed by pediatrician, and take that back to their provider if they're getting their care back at their primary care physician, and have a rationale behind that alternative schedule, as opposed to what's occurring now. Parents just tend to pick immunizations that they don't want their child to have without necessarily knowing the consequences.